Should I use dexamethasone for altitude sickness prevention? If you are planning a high-altitude hike or mountaineering trip, you may be wondering about the role of dexamethasone in preventing altitude sickness. This medication is a corticosteroid that can help with acute mountain sickness and high-altitude cerebral edema, both serious conditions that can arise at high elevations. Dexamethasone works by reducing inflammation and decreasing brain swelling, which can occur when you ascend quickly to high altitudes. For hikers and mountaineers, dexamethasone can be effective in preventing acute mountain sickness, especially for those at moderate to high risk. The typical preventive dose is 4 milligrams taken twice daily. However, it is important to note that lower doses may not provide the same level of effectiveness. While dexamethasone can help prevent symptoms, it does not assist the body in acclimatizing to high altitude. This means it does not improve your body's natural ability to adjust to lower oxygen levels over time. Although dexamethasone is effective, it is generally not the first choice for altitude sickness prevention. Acetazolamide is often preferred because it helps speed up the acclimatization process by promoting increased breathing and oxygenation. Dexamethasone is typically reserved for those who cannot take acetazolamide or for treating symptoms once they develop. When considering dexamethasone for your hiking plans, keep in mind a few practical points. It can help prevent symptoms and treat acute mountain sickness and high-altitude cerebral edema, but it should not replace a gradual ascent. Gradual ascent remains the safest and most effective way to prevent altitude sickness. Dexamethasone is particularly useful when rapid ascent is unavoidable or when symptoms arise despite other preventive measures. It is also essential to consider the potential side effects and the need for medical supervision before using dexamethasone. It is not recommended for routine use among all hikers. Instead, it is best suited for those at higher risk or those with a history of altitude sickness. In summary, dexamethasone can be a helpful option for altitude sickness prevention, especially for those at increased risk or when other preventive measures are insufficient. However, it should be used thoughtfully, alongside proper acclimatization strategies, and not as a substitute for a gradual ascent or other preventive medications like acetazolamide.